as a warning from history of what happened in Europe during the 1930s and 40s. And young people come from all over the United Kingdom, particularly around the Midlands, to take part in discussions, see the museums. Here you see them meeting with a Holocaust survivor. But as a warning from history, sorry, a film's going to come on in just 1 minute, but as a warning from history, it raised a lot of questions to us when, in 1994, the genocide in Rwanda took place. In full view of the international community and the media, this time we saw it real time. There was a lot of confusion about what was going on, that it was portrayed as this yet another African conflict. We all know and rehearsed about the failure of states, the media, international community, the United Nations, but what we wanted to do is start a relatively small organisation to start to unpick what those questions meant to us as individuals, perhaps to our own government, to the media. How can we start to learn some of the details of what went on, so that we don't have empty slogans about never again will this happen, but actually what do we mean by that? What does it actually take to prevent a genocide, and what do we mean by prevention even? As a medical doctor, I was interested particularly in how public health physicians apply this idea of different stages of prevention, from primary, secondary, tertiary prevention. Secondary prevention is when there is an actual crisis, like a heart attack happening, a myocardial infarction, and the patient needs urgent management. And I say management, not treatment, not even diagnosis. They need managing. You know, so often we get hung up about is it or is it not genocide. When somebody comes into the emergency department with central chest pain, we don't, of course we want to know as soon as possible, is this a myocardial infarct? It does make a difference, but actually what really matters is how you manage a patient, keep somebody alive in a crisis first, and let the diagnosis happen sometimes later. And I think the same can be applied to genocide. We understand this is an emergency crisis, it's genocidal in nature. There are mass atrocities possibly happening. How do we manage that from a humanitarian aspect, from a security aspect, protecting civilians, as well as from a political, a traditional conflict prevention aspect? So these were some of the ideas as secondary prevention. Tertiary prevention in public health, and we can also apply this to genocide and mass atrocities, is when after the event and after the crisis, to recognize there is ongoing suffering. There is ongoing consequences of this crisis, and if we failed at the time to identify it in a timely way, if we failed to protect and prevent, at least after the event we can do whatever we can to help rebuild, help to provide support, both psychological and material support for the survivors and their communities, and we can look to see how the whole cycle of violence can be, that often occurs, can perhaps be mitigated in some way. But what was of particular interest is about primary prevention, real early prevention. When the warning signs are there, the early signs of the stages 1, 2, and 3 of Gregory Stanton's, and 4 of Gregory Stanton's steps towards genocide, 8 stages of genocide. How do you deal with the sort of ideology that threatens groups, perhaps 5, 10, 20 years away? How do you identify high-risk countries and states, people are at risk, and develop strategies to, if you like, nip the problem in a bud, So this is what the whole concept was behind the Aegis Trust. Just want to show you a short film about some of the context and history of Aegis. There should be some sound. Here we go. Thank you.
I've seen pain, resting on the shoulders of your name. Do you see the truth through all their lives? Do you see the world through troubled eyes? And if you want to talk about it anymore, lie here on the floor, cry on my shoulder. I'm a friend. I have seen, but I have seen death. Live to see a lover's final breath. Do you see my guilt? Should I feel fright? Is the fire of hesitation burning bright? And if you want to talk about it once again, on you I depend. I'll cry on your shoulder. You're a friend. You and I have lived through many things. I'll hold on to your heart. I wouldn't cry for anything. But don't go tearing your life apart. I have seen fear, I have seen faith, seen the look of anger on your face. And if you want to talk about what will be, come and sit with me and cry on my shoulder. I'm a friend. And if you want to talk about it anymore, lie here on the floor, cry on my shoulder once again. On my shoulder, I'm a friend.
Oops, here we go. And how we get rid of that? There we go. So, Aegis Trust was based in London, and we did do a lot of campaigning type of work, and this is a picture of one of the campaigns that we were involved in relation to Darfur. This is in London, and actually outside the Sudanese embassy. But what I want to talk to you about in particular today is the developing program in Rwanda, and to focus in on this as a both, I guess, as a tertiary prevention, sort of rebuilding project, but also as a primary prevention project through education. So in 2002, the government of Rwanda invited Aegis Trust, and I'm very sorry that the Minister for Culture, I've heard, will not be speaking today, Protain Mitali. His predecessor invited Aegis Trust to work with the government in Rwanda, specifically in relation to the memorials. And I think that they had a real, quite a profound foresight about the genocide memorial. One of their concerns was about preserving the memory and providing some dignity for the victims that were buried. And you know, at this site here, the Kigali Genocide Memorial, around 250,000 victims of the genocide are buried. And the government wanted to create a place where people could be remembered, where survivors could come, and it was working in conjunction with survivors groups, where the whole community could work together, but also where the memory could be presented in a way that would bring people together. Yes, they were aware that denial of genocide, the 8th stage of genocide, as we were reminded by Professor Stanton, will happen, and they wanted to address that. But why? It's not just because of about forgetfulness alone. It's not just about fighting denial, combating denial alone. It's because what the denial was about, and what it is about that there is remaining ideology, there are remaining people around who are still sympathetic to the extremists and the radical groups that committed genocide in the first place. And how do you address that? Through education. And that's been the challenge that we've had since 2002. This place opened in 2004. Aegis Trust has managed it on behalf of the government since then, and still does today. We have a lot of visitors, particularly in April time. This is a group of school children that are visiting having a ceremony at one of the mass graves. So this is about remembrance, but it's much more than that. It's about the future. And we've had many discussions with the Rwandan educators about what does education prevention mean. Is it about teaching the history of the genocide? Actually, there's an argument that could make things worse. It could stir up animosities. What about the collective guilt, the collective blame that second generation may have to carry in those kind of education programs when you have children of survivors, children of perpetrators in the same classroom learning about these events? So we wanted to get away from just teaching about the history to try and understand, unpick what it is that we're trying to do with prevention education. One idea was, well, all this is about social cohesion, and what do we mean by social cohesion? Now the program is called the Peace Building Program. But again, what really does that mean? I think that what we looked at was, to start with, those people in times of genocide that did not participate, that in fact went beyond not participating and being a bystander, but rescuing people, risking their lives to rescue people. What was it about their attributes that led them to do that when everyone else in the same environment, or possibly many people in the same environment, were participating in mass atrocity? And the conclusion is that, one, they had empathy from people outside of their own community. The second, they had independent thinking. They had critical thinking. So when the media and the propaganda was broadcasting about these cockroaches, they didn't see these people's cockroaches as one. They had empathy. These are human beings. They're my brothers and sisters, as one of the rescuers at the Gisimba Memorial said. But secondly, they had this ability to think for themselves. So the idea is, can that become more broader in an education program? But first, before going on to education, there's a documentation centre has been started there. And this is going to grow around the 20th commemoration, which is April next year, into more of a sort of an international standard archive that will be accessed by researchers from all around the world through an online facility. But particularly there will be a research centre there at the new memorial in Rwanda to try to understand the details of what went wrong, not just kind of broad brush, because if we can understand the details, then perhaps we can start to apply better methodology in terms of practice for prevention, both through education and in other ways. This is the Peace Building Program. It happens in small groups where there's discussions taking place and debates from children from all sorts of different backgrounds. There's some of the aims here about what we're trying to actually create some definitions about what we're trying to deal with. But the key is this bottom sentence here about promoting trust between second generation, breaking down that fear and the suspicion that remains, generating empathy and critical thinking. We can't reach all these students. Only 11,000 students have come in the capital city. And considering there's about 2.5 million students in the country, we're only having a drop in the ocean. So from July this year, with support from the Swedish and the British government, and we expect some other governments also to support this, a new national programme will be developed. It's in conjunction with the government. Aegis Trust is coordinating this, but with other local groups such as the Institute for Dialogue, Research and Peace in Rwanda and other partner organisations. It's not just that there will be a mobile exhibition going out there, it'll be a whole facilitated programme. And the local educators, Rwandan educators, have come up with this idea that they want to tell stories. Yes, reach these aims, but we'll do it a Rwandan way, an African way of storytelling, but choosing the stories carefully, so that the right kind of discussions and debates can take place. So here's an example. Many of the stories have been put into this cartoon by, again, a local artist, so that students from different literacy backgrounds can access these stories. And this is a story of Grace. You see this little girl who was fleeing with her family to Goma, to the DRC. The RPF were, of course, about to liberate Kigali, and she was a member of a Hutu family that was fleeing. And she saw a baby. In fact, she heard the baby crying. It was hanging onto her mother's breast. Mother was still alive, but was dying from her wounds, her neck and head wounds from a machete. And she was 10 years old, caught eye contact with the mother, who was pleading, please save my baby. Her grandmother and her family were saying, no, you leave this cockroach alone. They all have to die, and besides, if you pick this up, you'll endanger all of us. This 10-year-old girl has to make a decision. What does she do? Listen to her family, her community, in the midst of all this chaos of the refugees leaving, and she has to make a split-second decision. She decides to pick the baby up and carry it, continuing to be under pressure from her family. So they ended up in the refugee camp in Goma. Short story of this is she became the sister and the mother, and they still live together. The baby was named Vanessa, has gone through high school, and this is a story that is being told because any children from whatever their background, coming with all sorts of perhaps baggage about what their family were involved in or weren't involved in, what their family suffered, can relate to this 10-year-old girl. And the discussions that then ensue about what would you do if you were in that kind of position? And what should we do, indeed, what should we do today? And the fact, of course, the story is that you have a Hutu woman and a Tutsi girl who've now become family as well. It shows actually those divisions are constructs that can be actually broken down. And in this case, it was broken down by a 10-year-old girl. And as Professor Stanton said, by the love of a 10-year-old girl. These are some of the stories. This is Grace, and this is Vanessa. So they get to meet, either through photographs or often in person, the people in the stories, or through films. These are other people who are stories. I won't go into detail because I've probably way talked over the 20 minutes now. But these are other people's stories that are incorporated into this. And there are stories of other people that have created all sorts of peace building and reconciliation programs that are told as well. And the idea is you get debates going and discussions going to help people think about their own identity, their own individual responsibilities. Sorry if this. I just want to skip on a little bit. But the memorial isn't just for local students or even the local survivors community. It's visited by people from all over the world. Sorry, this is maybe not a great example. But George Bush came here, he was president. I'm not sure it had a great impact on his policies. I hope it didn't. We can't claim to have had any impact on his policies anyway. But nonetheless, it does come. And actually, there were serious discussions that are taking place with people who, from all backgrounds, who come to the memorial about the failures of the international community. Ban Ki-moon has been there 3 times. He was there just last week. And has made many statements about how he can't go to the center without crying, but also about how he goes back to New York and talks with his colleagues about these lessons, about the responsibility that they have. So memory is important for prevention, but of course we know full well, and this whole conference is about, it's not just about statements and the Secretary General's crying, but about actually what we do and the discussions that take place beyond that. One final comment, I did mention it earlier on the panel. This was a group of British parliamentarians. Actually, David Cameron was in opposition at this time when he when he visited. But out of some of these discussions, Aegis Trust has been coordinating a group of MPs with a specific interest in the prevention of mass atrocities and genocide. As it was mentioned in the film that one of the successes of that group was to change British law to allow the prosecution of genocide suspects that were residing in the UK. So parliamentarians can play an important role in changing policy, changing legislation, but most importantly, helping to bring their governments to account for their own responsibilities, whether it's national, regional, or international responsibilities. As a consequence of all of this, it's planned in March or April next year that there will be a conference of parliamentarians to try to launch a network of parliamentarians for the prevention of genocide in Kigali, marking the 20th commemoration of the genocide. So it's a symbolism, a powerful symbolism of the 20th commemoration, but saying, well, actually, this isn't just about statements of parliamentarians. This is about trying to institutionalize these groups, network them throughout the world so they can share best practice. If legislation's been changed in one parliament, could we learn in another parliament? If there is accountability being brought or questions being brought to governments about their own role. We're not just talking about Britain here, but the idea that the Rwandan parliament hosting this is there'll be a network of African parliaments that will be showing the lead on this in the 20th commemoration. So that's all I wanted to say.